Hello, my name is Dr. Philip Miller. I'm a facial plastic surgeon practicing in Manhattan, New York. I'd like to speak to you this morning about rhinoplasty terminology. Rhinoplasty is cosmetic surgery of the nose, and what I mean by terminology is the words that we used in order to describe the nasal changes that we want or the nasal problems that we see. It's important that we have, meaning the patient and me, have the right terminology so that we understand exactly what it is that the patient's unhappy with. A good example is that when a patient comes in and says, "I want my nose straight." Well, I would say half the patients mean that from the front view, their nose is a little crooked. And half of the patients mean from the side view, their nose has a little bump and they want it straight. So it's important for us to communicate well to identify exactly what it is that you, the patient, want changed. Another term that's important to know is about the tip. Surgeons, or I, use the concept of projection, and that means how far the tip of the nose is projecting off of the face. That's in distinction to rotation. Rotation refers to, is the tip rotated down or is the tip rotated up? Other features that are described are the width of the nose. Now, when I describe the width of the nose, there's two areas that can have width. The facial plane, which is the area right down where the cheek meets the nose, that is what I call the facial plane and the facial width. That's in distinction to the dorsal width, or the width of the nose along the bridge of the nose. So most of all, what I'd like to convey with this video is that it's important that you, the patient, understand the terminology that I use and that we use as facial plastic surgeons. And it's important for us to understand exactly what you mean when you say certain terms like, "I want my nose straight." This is Dr. Philip Miller explaining rhinoplasty terminology. Have a good day.